Someone comes to me and they say, I sleep all the time. How do I, as a psychiatric nurse practitioner, know that that is hypersomnolence or if it's associated with something else? And how do you think that makes people feel? Like, if that's the symptom that's coming forward, that they sleep all the time, if that was you, how would that make you feel? Well, 5 to 10% of people who present at a sleep clinic complain of hypersomnolence. However, only 1% of the population has it. So we're going to talk about how we actually diagnose this disorder. The first part is self-reported, right? Someone comes in, they say, I'm sleeping all the time. The first thing that we ask is do you have a regular sleep schedule? Do you sleep 7 hours on a normal time each day? And then, how much over that does that go, right? And we're looking for things that go over 9 hours, and it can be 9 hours straight or, 8-9 hours plus a 2-hour nap and still not feeling refreshed. So this is all self-report of, kind of their sleep schedule. So we're making sure that it's just not poor sleep hygiene, and, making sure that there's actually a pattern over 3-month period of time, and it causes significant distress. All diagnoses have that criteria of it impacts either their cognitive function, their social function, something, with their work, not being able to go to work or having to go home early to take a nap or feeling like they can't work. Now, when you look at the first 3 criteria for that diagnosis, it could be a lot of people that I see. So it's the second part of the diagnostic criteria are the most important. Is this some sort of sleep disorder? Okay, narcolepsy is an actual brain wave problem where someone can just stop and go to sleep in the middle of the day. And so we need to make sure that it's not narcolepsy, and that is and sleep apnea, both of which are diagnosed through a sleep study or another sleep diagnosis. E is that it's not associated with a substance use. Many abused substances cause our CNS depressants. Alcohol is a CNS depressant, opioids, benzodiazepines. These all shut down the brain, and so there's going to be more sleep. So we have to assess and talk to you about whether you're using substances or not. And then let me just rewind for a minute, because sometimes when we think of substance abuse, we think of substances that actually cause CNS depression, but cocaine and methamphetamine are stimulants. They increase, but the withdrawal symptom is hypersomnolence, right? So when someone is withdrawing off of a amphetamine, they will sleep more. So it's not a disorder, it is a withdrawal symptom. And then also making sure that we are assessing for coexisting mental health or medical diagnoses. So if you came to me and you said, I'm sleeping all the time, and I just said, oh, you have hypersomnolence, drink more coffee. And some people actually treat it with stimulants. If I'm not taking the time and doing labs and looking, is there a medical reason? Are we low in vitamins? Are we anemic? So ruling out medical conditions as well as mental health. One of the number one symptoms of depression is hypersomnolence, right? Just feeling so depressed they don't want to get out of bed. But it's easier sometimes, or there's less stigma to say, I'm sleeping all the time, rather than saying I'm depressed. So making sure that we are asking those questions about depression or other mental health or stressors, grief, trauma, all of that can contribute to just wanting to sleep, right? It could be kind of a coping mechanism around that. So when we're looking at hypersomnolence as a diagnosis, it can be with those mental health conditions. You can have depression, you're treating your depression, you feel better, but maybe you still have hypersomnolence that we need to treat separately. So you can have it coexisting, but making sure that we're not just giving that hypersomnolence and not assessing the whole person. So that is understanding hypersomnolence. I am Cristi Bundukamara, psychiatric nurse practitioner, and continue to follow for more free content.